I'm a general medicine resident, so we do handle a lot of diabetes and diabetes complications. We do see a fair bit of specifically podiatry related complications. Building on what we have talked about in the past, we touched upon the basics of diabetes, how it develops, you get that insulin resistance, that high blood sugar, and today we'll focus on the complications of these, like what we can see in the clinic and what you can keep an eye on at home as well, with a really big emphasis that a lot of these complications are preventable. Knowledge is power, so just trying to share some of this knowledge with you so that if you feel like any of these changes are happening to you, you can reach out to a healthcare provider and they'd be glad to assist you differentiating some problems from maybe not a big problem. So this is what we'll cover today. Definitely some foot complications, some eye complications, kidney, nerve, heart, and then we'll end it with some screening recommendations and what you can continue to do at home as well in between doctor's appointments. So just to start, diabetes can truly affect every single part of the body. And this is an image I found from a Nature publication, but trying to hammer this home early because we do know that diabetes really does affect every part of the body. We may think of specific areas like the feet or the hands or the eyes, but it can affect your muscles, your liver, your heart, your brain. So just keeping that in mind. Here we will talk about how blood sugar causes this damage. The most kind of basic way to think about this is you have a lot of excess high blood sugar that's floating around in your blood, and it can become sticky and it sticks to your blood vessels. And as you can see over here, this is a depiction of what some blood sugar deposition in your artery or endovasculature would look like. And you can see here are your red blood cells and they're squeezing by to get past this. This is like some vascular disease that could be as a result of diabetes. And from here, you can get issues with the small vessels in your eye and your kidneys and your nerves. They commonly will present with issues earlier. And then as the diabetes stays chronic and you get this chronically high blood sugar, the small vessels that are already affected also lead to larger vessels being affected as more and more of the sugar and plaque gets deposited in your vessels. And that's where we can see things like heart disease, stroke, peripheral vascular disease, things like that. We'll start with some eye complications, and I always like to see what normal looks like, and then that helps me differentiate abnormal. So here, this is the normal retina. Even though it may appear abnormal, this is what your eyes will look like. Here is the optic disc and the fovea. But basically what can happen is we get some vessel leakage, and then because there's some blockages of the blood vessels in the small blood vessels, our body tries to compensate by building new blood vessels. And these new blood vessels can be a little bit weaker and they may be more prone to bleeding and have additional leakage. And as you can see here, these are some spots of leakage and these are some fatty depositions here. What you could see if you have some complications with the eye is some blurred vision, which we'll touch upon, some floaters, difficulty seeing at night. But a lot of patients don't really have any symptoms or they don't really notice any symptoms. So that's why it's really important that we do what's called a dilated eye exam. So patients that come into my clinic, we'll make sure that they see an eye doctor, and every year they will go to get a dilated eye exam where an eye doctor or an optometrist will look at the back of the eye to make sure that the vessels look healthy, there's not a lot of bleeding or there's not a lot of plaque there. And here we can see that early detection and treatment can prevent 90% of diabetes-related blindness, which is just a huge number. And that will be a take-home point from a lot of these complications, is that keeping a very strict control on your blood sugar can really help prevent these downstream effects. This is something called an Amsler grid, and you can print this out. Just Google Amsler grid and keep it on the fridge or something. But basically, this can help to see if you have any change in your vision. So on the left, we would see, hopefully it looks normal to you guys. And then if there was any issues with your eye, you may see what the middle is depicting here, which is either a missing area. You'll see like a black spot somewhere. Some of the lines may be distorted or curvy. And you can also see that on the right side as well without that blind spot in the middle here. Not something that you definitely have to do every day. And over time, you may have vision changes, but just something that you can do at home. And then if there's any concern, you can definitely bring this up with the healthcare provider and they can go through it with you as well. The next thing I want to talk about is the kidney, and diabetes, unfortunately, is the number one cause of kidney failure in the United States. And it happens similar to with the eye, where you have very small, delicate blood vessels, similar in the kidney, and the damage to these blood vessels impede the ability for it to filter toxins and things like that from your blood. The complications that we see typically are due to losing protein. So we spill protein in the urine, and that's why every year your doctor may want you to, or should want you to get what's called a urine albumin creatinine, or basically testing the protein in your urine. You'll provide a urine sample, and then the lab can tell your provider how much protein is in the urine. And once it gets over a certain point, that can tell us that, hey, the kidney has some damage to it, likely from the diabetes, and we can be a little bit more aggressive with the blood pressure control and diabetes control. Both of those can have effects on your kidney. If you are prescribed a medication in the ACE or ARB class, these are blood pressure medications. Names are like lisinopril, losartan, or SGLT2. This is like empagliflozin. The brand name is Jardiance, or a GLP-1. GLP-1s have a lot of great evidence that they can protect kidney disease progression. It's important that you continue to take these medications if your doctor or healthcare provider thinks that is indicated for you. What you can look out for at home is if you have any kind of swelling in your feet here. This is called edema. You may get it in your legs or your abdomen as well, but typically because we're standing and our feet are our most dependent part of our bodies, you'll get some fluid accumulation here. Just because you have edema or some fluid on you definitely does not mean that you have kidney disease. So just want to put that caveat there, because many people do have some lower extremity swelling. Towards the end of the day, I also have lower extremity swelling. You can tell it on my sock line, on my legs. There's many reasons to have some swelling, and many of them can be normal, but it's just something to look out for. If you suddenly develop a lot of swelling in your legs, definitely talk with your doctor. Additionally, something you can also keep an eye on would be the amount of foam in your urine, which is a funny topic to think about, but your urine can tell us a lot. Like we already talked about, we can test the amount of protein in your urine, but if you notice that your urine is bubbling up a lot and staying foamy for several minutes, that may be a sign that you have a significant amount of spillage in your urine, and something that you can bring up with your doctor. They also have some test strips that can detect protein. You can ask your doctor for those. Those are used a little bit less commonly. More so, we'll just do the yearly albumin check or that urine protein check, and then we'll also do creatinine or your kidney function check every year. Moving on to nerve complications or neuropathy. A lot of people have heard of neuropathy. It can be described as a pain, like a burning sensation, pins and needles. Usually it starts in the feet and moves up as time goes on. It can be described as like a glove and stocking distribution, meaning that it's in your hands and your feet earliest, because that's where the nerves are the smallest and the most susceptible to damage from diabetes. Things to keep an eye out for would be numbness or decreased sensation, that tingling, burning sensation that we talked about, or that pins and needles. If you have extreme sensitivity to touch, that sometimes can be a sign of neuropathy as well. It can also affect other parts of our body. You can get difficulty with urination. It can cause you to have urinary retention or incontinence, but more retention where you're not really able to relax your bladder because the nerve endings in your bladder aren't as sensitive, and you sometimes don't realize that you have a full bladder. Additionally, men can experience erectile dysfunction or difficulties maintaining erection as well. What we do for this to screen is we do what's called a monofilament test, and this is a picture of that here, where we take a very small, it's almost like the tip of a paintbrush or like a bristle. It's not painful at all, and we test multiple locations on the patient's foot to see if they're able to detect us touching this area of their foot. And what we do is we keep track of that to see if there's progression of this change in sensation over time. And if this is present, there are certain medications that sometimes can help with the pain, but typically the mainstay of treatment is just better blood sugar control. Some of these can get to a point where it's irreversible, but if you catch it early enough and you're aggressive with your blood sugar control, some of that sensory changes can be reversed. What you can do at home is if you have anything, even like a pen or a pencil eraser, you can test your sensation, checking the bottom of your foot, making sure that you can feel whatever stimuli you're pushing onto your foot. Additionally, patients with diabetes have a significantly higher risk for heart disease and stroke. Heart disease is the number one cause of death in patients with diabetes. You have a 2 to 4 times higher risk than patients without diabetes. So definitely something that we want to keep an eye on. These may be more evident symptoms. You may experience chest pain, shortness of breath. If you have leg pain when you're walking, or cramping, or claudication is the medical term, these can be some signs that you have some more large vessel issues. And some of this may be related to diabetes, but also high cholesterol, high blood pressure can lead to things like this. Because patients with diabetes may also have some issues with blood pressure and issues with cholesterol, it's really important that we treat the person as a whole and keep an eye on all of these factors as well, as we touch upon down here, so that we can optimize your health and reduce your risk for these larger, sometimes catastrophic events such as a heart attack or stroke. So that's why it's very important to continue to check your blood sugar, your blood pressure, and your cholesterol. Specifically with high cholesterol, if you're recommended to take a statin, it's important to take that. Avoiding tobacco tobacco, maintaining an active lifestyle with a healthy diet as well, obviously, will help with this. Patients with diabetes, both type 1 and type 2, are at risk for high and low blood sugar. This is sometimes due to the medications that we're on for the diabetes, but also because of the diabetes itself. So patients with type 1 diabetes are typically thought of as not really producing insulin at all. So you require exogenous, or you require insulin that you inject into your body to mimic the insulin that your pancreas, that's the endocrine organ that produces the insulin in the middle of your belly, in an attempt to mimic the insulin that your pancreas should be producing. And with insulin, there's always a risk of having low blood sugar, and some medications for type 2 diabetes as well can cause some low blood sugar. These are risks of diabetes, but it's more so related to the treatments of the diabetes. And then on the other side, you're at risk for high blood sugar or hyperglycemia. And this can lead to things, if you've ever heard of DKA or diabetic ketoacidosis, this is more common in type 1s, or HHS, which is similar to DKA. It's a little bit nuanced, but it's more common in type 2 diabetes, but similar presentation. You can present with shaking, sweating, a lot of nausea, vomiting. Sometimes you can have confusion, excessive thirst or urination, and a loss of consciousness, and maybe even seizure. Potentially it can be fatal as well. It's very important to keep a close eye on your blood sugars, making sure that they do not go too low. Now we try to use what's called a continuous glucose monitor in some of our patients that are able to use this. This is empowering the patient to have more data points and be a little bit more involved in their care. It's like a sticker. Usually you put it on the side of your arm here, and it continuously monitors your sugar. And if you have a smartphone or a tablet or anything like that, or sometimes it even just gets sent to your provider's office, but you can see and track the changes of your blood sugar, seeing how your diet can affect your blood sugar, how your blood sugar changes with each dose of insulin, which can be helpful not only for titrating insulin levels and managing your diabetes, but also avoiding certain foods that may cause your blood sugar to spike. Each person is a little bit different about that. I talked a little bit about the glucose sensitivity, your body's response to each carbohydrate load, and each person will have a different response in terms of the amount of glucose spike that they would have, or your glycemic index. So it's an important tool that you can use for titrating medication and also adjusting your lifestyle in order to keep your blood sugars in the most ideal range as possible. Typically in the hospital, we're a little bit more liberal with the range of blood sugars between 100 and 180. When patients are at home, we try to keep that a little bit more aggressive and a little bit less, like 140s, 160s, less than that, but more than 80 or so. Definitely a great tool to use, but you do not need one. You can always use the tried and true finger stick, although it's not as fun for the patient. It has the same efficacy, and sometimes it's even more accurate. There's some issues with CGMs or the continuous monitors. It's a little bit of a trial and error with those. So moving on to some foot complications, it is really important that we do talk about this. More than 2 million people in the United States and 18 million worldwide will develop a foot ulcer that is related to diabetes. There's over 160,000 amputations per year that are related to diabetes. And then in general, related to like all the amputations, more than 70% are related to diabetes. So significant morbidity related to uncontrolled diabetes, specifically with amputations and things like that. So very important that we keep a close eye on that. So here's just a broad sense of what happens. So you get that decreased sensation, what we talked about, where the nerves really aren't able to be as sensitive. They're a little bit duller. Because of this, you're at an increased risk for injury because your body is not as sensitive to pain. So think about if you were to put a very sharp needle on your finger, the nerve endings in your hand without neuropathy, you'd probably jump and move your hand very quickly. However, if you have damage to your nerves, the needle may cause a tiny injury and you would not really be able to tell that you had this injury. And then what can happen is it can become infected. And because you have issues with the vasculature and with the blood vessels, and because there's sometimes blockages in the blood vessels and the deposition of the sugars, you can get decreased wound healing due to this poor blood flow, which kind of exacerbates the injury, because normally our body floods that area with cytokines, or these tiny messengers that tells our body, hey, we need to really work on this area because there's some infection or there's some damage to this area. Our bodies respond a little bit differently when we have pretty significant diabetes, which causes that wound or infection to progress, and that can become life-threatening. It can require antibiotic surgeries like amputation. So very important that we try to catch this as early as possible. Diabetes really does create this perfect storm. So you get this loss of sensation, poor circulation, slow response, and slow healing, and then your increased risk for infection, which can be life-threatening. So here's an image here where it depicts a little bit of an ulcer here on the side of someone's foot. And as we showed in the other one, I'm a very visual person, so I'm a big diagram fan. You can see that there's some reduction in blood flow. Let's say right here, this would be an example of this blood vessel. So there'd be less cells that could go to this area to try to repair it. Similarly, this is a depiction of a nerve that is damaged due to the blood sugar depositions, which kind of leads to that initial injury right there. And as we see here, a minor injury can definitely become a major problem if not caught and treated early. What we do is we try to inspect and really keep a close eye on the amount of sensation that someone has on their feet. So what you can do is check your feet daily. Some patients have difficulties looking at the bottom of their feet, understandably. So if you have a mirror or any reflective surface, you can use that as well to try to look at the undersurface of your feet, looking for cuts, blisters, redness, swelling, calluses. And if you have a callus or a blister, it may not be apparent that this is like an open wound, but it could mean that your foot in your shoe is rubbing against a part of the shoe that it could eventually cause an erosion or an ulceration. So those are early signs that your foot is under a lot of pressure. So something to keep in mind there, making sure that we have adequate hygiene with our feet, washing them properly, using soap. You don't really need to soak the feet, as this can soften the skin. And if there's any kind of cracks in the skin, it can cause them to widen and sometimes worsen. And making sure that your feet stay dry, especially between the toes. You can use powders, wool socks, things like this as well. Making sure that we moisturize to prevent those cracked skin, as we've talked about. They can be an entry point for infection, specifically fungal infections, but also bacterial as well. Then making sure that we adequately take care of our nails. A lot of people will come into office and I take a look at their nails and they have a lot of difficulty either due to mobility or time constraints or what have you, but their nail care has really fallen to the wayside and they develop very thick nails, sometimes causing or related to a fungal infection, but it can also cause like an ulceration to the toe next to it because the toenail itself is so strong, it can dig into the skin to the toe next to it. So in those cases, we refer people to a podiatrist and they can get routine nail care, or they'll go every 6 months or so and they'll have their nails trimmed and monitored for fungal infections or other issues related to their nails. Making your foot care a daily routine really will reduce the burden on you. So think of it as just like an extension of your daily routine. You're brushing your teeth. It'll take a few minutes just to look at your feet. Sometimes after the shower is helpful too because you're drying off your feet and that's a good time to take a look. Some important tips as well are to wear well-footed closed-toed shoes, and you can consider a diabetic shoe if recommended. Medicare and other insurances typically will cover diabetic shoes. Here's an example of one. You may not be winning any style contest with these shoes, but safety is the new style. Definitely take priority in the safety aspects of your shoes. Making sure that you wear clean, dry socks daily, avoiding excessively tight bands. I know that some patients will use tight socks to reduce swelling, which are great, and I do recommend a lot of patients wear those, but making sure that it's not cutting off circulation to your foot. Things to avoid to reduce your risk for getting cuts and infections would be making sure that you're not really walking around barefoot. I know that's easier said than done. Specifically, patients that have neuropathy, we really try to have them not walk around their home even with bare feet or like wearing sandals or flip-flops for a similar reason. You can imagine that if you have flip-flops, the bottom of your foot may be protected, but if you were to stub your toe, you may not be able to sense that, and that can lead to an infection. Making sure that you do not leave heating pads on your feet or exposing them to exceptionally hot water that can cause a burn to your feet. And then definitely you do not want to ignore a foot problem as they can progress very quickly. So definitely contact your doctor or healthcare provider if you have any open wound or sores, any concern for an infection as well. So what we recommend every year, your primary care provider, typically your endocrinologist or any kind of provider, can perform a comprehensive foot exam that includes a visual inspection. We'll check your pulses and your sensation as well. With that monofilament test. We'll do that typically once a year. Some patients will also undergo a vibration test. We use a tuning fork. I don't do this as commonly as the monofilament test. I definitely do the monofilament test, and I think it's a little bit easier. Some patients may warrant what's called an ABI, or an ankle brachial index. This is a fancy term that basically just looks at the integrity of your blood vessels in your legs. And if there's some abnormalities, you may need to see a vascular physician who may try to remove some of those blockages that could have been deposited there from diabetes or high cholesterol. I have a very low threshold to send my patients to a podiatrist or a foot expert, specifically patients that I think may have some difficulties keeping up with their nail care or hygiene, just because I don't want something to happen and then we'd have to play catch up at the next visit or something like that. Some important screening tests that you should be aware of. These are pretty routine labs that your primary care provider can order for you. One is your A1C, or this is your average blood sugar. You should get this done every 3 to 6 months. It's an average of the intensity of the blood sugar over a 3-month period of time. So a lot of patients may not fully understand this, and they will say, oh, my A1C was high, but I just ate a donut before I came to the office, so I don't think I have diabetes. But really, it's more of an average. So it's not going to be affected by 1 or 2 meals. You don't need to fast for this test either, but it's going to be an average of your 3-month high blood sugar. Our goal is less than 7. The diagnosis of diabetes is made greater than 6.5. So we try to be pretty aggressive. This is the number that we'll use to titrate patients' blood sugar medications over a longer period of time. Definitely want to make sure that we're checking your blood pressure. You can also do this at home with a blood pressure cuff. Our goal is usually below 130/80. Every patient is a little bit different, but that's the universal goal. Testing your cholesterol or your lipid panel. You want to know if your LDL or your quote bad cholesterol is high, which can lead to more vascular disease. And in combination with diabetes, those two can really build upon each other. Making sure that your kidney function is okay. As we talked about, this can be very susceptible to damage with diabetes. So we'll monitor your urine albumin as well as your creatinine, which is a blood test, which tells us how well your kidneys are filtering blood. We'll also send you to that eye doctor every year. They'll do that eye test, as we discussed, looking at your retina, and the comprehensive foot exam, as we talked about before. And then something that I learned was diabetes increases your risk for gum disease. So although we are already recommended to get a oral exam or a dental exam every 6 to 12 months, patients with diabetes, that recommendation is much stronger. Don't skip on the dentist, and make sure that is something that you incorporate into your routine as well. So what can you do at home? You can continue to monitor your blood sugar either with that glucose meter for the pinpricks or the continuous glucose monitors. If you bring in a log, I love when patients do this because it really helps me to adjust medications. So if you bring in a log with your blood sugar or your blood pressure, it tells the physician or provider what your averages have been, but it also tells them that you're invested in your health and this is what you've been doing at home outside of the hospital, which goes a long way with us because we really do want you all to be as healthy as possible. And it means a lot when a patient comes in and they bring us data that shows that, hey, I've been listening to what you said and this is what I've been seeing at home. So it just helps strengthen your relationship with your healthcare provider. Making sure that you continue to do those foot checks. You can get a scale, specifically patients that may have heart issues. I think this is more important, but making sure that your weight doesn't fluctuate too much in a short period of time. And then, like we already talked about with that Amsler grid, you can print that out. That's a pretty quick and easy way. You can take a look at that and see if there's any changes to your vision that you may have concerns with. These are just some typical normal ranges, but your personal targets may differ. So key takeaways, a lot of these complications, although scary, they are preventable. So making sure that we're as aggressive as possible with your blood sugar control, avoiding complications of high and low blood sugar at that same time as well. Making sure you stay on top of your screenings. Early detection definitely can save your life and your limb. Keep a close eye on your feet, and you are your best monitor and you know your body the best. So if you feel like you have a new symptom, you should feel empowered to reach out to your healthcare provider or physician to have a more in-depth discussion about that. We're happy always to answer any questions about someone's concern for their health, even if it is not a big deal. Please leave that up for us to decide so that you don't have to dwell on something that you think, oh, is this a big deal? Is it not a big deal? Just send your primary care a message. Here's some good resources that you can take a look at as well. One kind of interesting point too is some patients, they get very nervous when they come to the doctors and they can get what's called white coat hypertension. Normally your blood pressure is fine, but every time you go to the doctor, your blood pressure is higher than our goal. You may be started on a medication, but if you can show me that every time you check your blood pressure at home in a non-stressful environment, your blood pressure is not elevated, we don't have to start you on a blood pressure medication if we know that for the majority of the time your blood pressure is normal. It's just certain circumstances that raise your blood pressure.
Having cold feet, cold extremities of feet in particular, is at all a sign of neuropathy or related complications.
Changes in temperature can definitely be a sign of neuropathy potentially, or a change in blood flow, but it definitely does not mean that you have issues with neuropathy or poor blood flow. A lot of patients will just have cold hands. They say, oh, I have cold feet all the time. And you could run every test in the book and it would be completely normal. So it really just depends on the person. I think that if it's something that's causing you significant distress or you're really concerned about it, definitely speak with your healthcare provider about it. But we typically will be more concerned in terms of diabetes if you're having sensory changes. So that numbness, that pins and needles feeling. If you are getting cold feet and then your pulses are weak, which your provider can tell, or if you have difficulty feeling the pulses in your feet, that may indicate that you do have some vascular changes, and that may warrant a further evaluation with imaging, such as an ABI or an ultrasound or a CT scan or something like that.
How often is it that foot problems are like an initial sign that helps you diagnose diabetes? Or is that generally something that you know someone is diabetic already, they're seeing a podiatrist and you see those symptoms? It's not like a diagnostic where you start them.
I think that because we get blood work very routinely on our patients, even if they do not have signs. But in general, I think that someone who does not have a previous diagnosis of diabetes would have other symptoms that would predate your neuropathy. So if you have excess thirst or frequency with urination, vision changes, you're fatigued a lot, some of those more generalized, non-specific symptoms may be earlier on compared to the neuropathy. But that's not to say that someone hasn't presented to the hospital without diabetes and they have a foot wound or something like that. But making sure that if you feel like you're drinking a lot of water, having frequent urination, tired a lot, those things are more related to acute changes in blood sugar.
Kidney stones, is that something that you see with diabetes? And what is it that causes that?
So kidney stones indirectly can be related to diabetes, but typically you can get different types of kidney stones, and this could be like a whole thing, but certain like calcium oxalate or a specific type of kidney stones, if you have poorly controlled diabetes that leads to pretty significant kidney disease, your levels of calcium and vitamin D can be off, and that can predispose you to having some kidney stones. But typically it is not something that is directly related to high blood sugar or diabetes.
If you have a line in your toenail, is that indicative of something? A black line in your toenail?
I probably would have to see it.
Yeah,
I'm
yeah,
not 100%
fair.
sure. We know that you can get certain nail changes for a variety of health reasons. One is an iron deficiency can cause you to have brittle nails. Thyroid issues can cause you to have change in nails. You may get thicker nails from diabetes. This is indirect, and it's more so a result of kind of increased abrasion to your nails because you're not really feeling that area as much. But typically, diabetes, from my understanding, would not cause directly changes to your nails. If there's any kind of concern about that, you should definitely reach out to your healthcare provider, because like our urine, which is a strange kind of thing, our nails can also tell us a lot about our health as well.